Welcome to my show, Lifestyle with Dr. Moby. I'm Dr. Moby, and we welcome you to an important topic today, and that's about sleep disorders. So, I would like to educate a little bit, and then we'll run the program. So, want to make sure everybody knows sleep disorders are most common disorders we encounter in primary care, specialty care also. And just to give you an idea, 40 million people suffer from insomnia. Most common disorders seen in sleep disorders, and also this is more very prevalent in women and older folks. So having said that, we welcome one of geriatric specialist with us. He's board certified in geriatric medicine, internal medicine. Dr. Jamil, we welcome you. Tell us a little bit about yourself.
I'm Dr. Ahmed, and I'm an internist and also geriatrician, and I practice mostly in geriatric population, but I have younger people too.
Okay, great. So today we're going to talk a little bit about insomnia, correct?
Yes.
And tell us a little bit what your experience is, since it's very prevalent in older folks also.
Well, after I thought about it, and I tried to search and see what are the stories about insomnia in the internet. And strangely enough, most of the mythologies and things are sleeping too much.
Mm-hmm.
And you'll be surprised to know that the Rip Van Winkle, who slept for many years
Mm-hmm.
and missed the whole Civil War,
Wow.
was in Catskill, New York story. Is in that mountain of Catskill.
Mm-hmm.
And I was surprised to know that too. Then even go long before that, and in Greek mythologies, there was a person named Hypnos.
Mm-hmm.
And Hypnos' brother was Thanatos. Thanatos is agent of death.
Okay.
And Hypnos is for sleep. They're twins, and one's job is to put people to sleep, and that is to take their life. And they used to live in a cave, and next to a stream, and the name of the stream was Forgetfulness. And I also thought very, very interesting story, but mythologies are good to read. But I didn't get too many information from the historical perspective, And so it is very common.
Mm-hmm.
In our practice, we do not ask people too much about sleep unless they complain of. We talk about high blood pressure, congestive heart failure, diabetes, and get all the measures. One of the common problems, like insomnia, is rarely asked.
Mm-hmm.
But when we ask, or when they complain that they cannot sleep, that has many meanings. One is that they have trouble falling asleep.
Yeah.
Another is they're waking up all night. And they sleep well, but wake up very early, then cannot go back to sleep again.
Mm-hmm.
Or say, I don't feel well, even after the good night's sleep.
Mm-hmm.
So there's different complaints they have.
Yeah. So what Dr. Jamil is trying to say is that insomnia constitutes different aspects of sleep. So falling asleep is one thing, remaining asleep for uninterrupted is second, and third is inability to fall back after waking up. So those three are very important components of insomnia. Then it's also defined actually in whether it's acute, which is less than 6 months, or stressful situation somebody could have, and then it is part of chronic problem which could be lasting more than 6 months. So they go by 3 which is 3 weeks problem over 3 months, and then or I think 6 months probably will be more realistic in terms of chronic. So tell us a little bit more about why do you think people start with insomnia problems?
This is very common. Almost 30% of all patients has issue with the sleep apnea. As Dr. Moby told you that situational sleep apnea, insomnia is not uncommon, but should not last more than 3 weeks. If it over 3 weeks, then it's a problem. It's going to affect your body somehow. And so we always ask, how long is going on? And then we'll tell that, I feel tired all day long.
Yeah.
And it's going on for 3 weeks, 4 weeks. Then you have to put an effort to find what is the reason. If you think that divide your sleep, there is a two kind of sleep. And they call REM sleep or rapid eye movement sleep. And there's a non-REM, that time you're not. Non-REM sleep is the longer part of the sleep. So and another is a sleep latency, or how long it takes to fall back to sleep. If you don't have a good sleep, you may have some of the physical and mental issues. One is the depression, and issue with the memory, can remember anything, and the daytime sleepiness, and even falls. So it has some implication. That's how we know this is a chronic, and you got to do something about it.
Sure.
And how much sleep do we need? Everybody's different.
Yeah.
Some people can sleep for 4 hours and do well. They are extremely minority, and probably you don't see them every day. And compared to most of the people, they will sleep between 7.5 to 9 hours. Some people need a little less or more. And how is it related? Some of the diseases actually are related with this sleep. Like people have a sleep problem, they tend to have heart disease, diabetes mellitus, or sugar problem. And there is some incidents that people who does shift work, like one day in the night, another is the day, and month after month, they tend to have more colon cancer and the prostate cancer. So we are not sure exactly, but obviously it changes our body from inside. And it only happens if you work for like 4 years. If you just do 1 year, it may not have effect, but some people work in a factory for years, and they have every shift they're changing. They are at higher risk for all the health issues.
Yeah, and that's very important because sleep. So, like Dr. Jamil clarified, make sure everybody is different. Some people need 4 hours, some 5 hours. Teenagers need more, 10 hours or more. Don't go by just numbers. Go by some. If you feel next day refreshed, you feel your mind is not foggy, lack of concentration, and you are hyperactive. Now, kids tend to become hyperactive more, and there was actually, for kids, they changed the hour time in Midwest, where I used to practice before. They changed the hour they wake up by 1 hour delay, and improved the scores in those schools. So that is really important. So insufficient sleep and insomnia are a little bit different. So insufficient sleep syndrome, people don't get enough sleep, and they tend to actually be sleepy during day, and they will fall asleep, and they take a nap and so forth, and they feel better. On the other hand, people with insomnia, they don't sleep during day. Their mind is super on high, too much stress on their mind, and they would not slow down. So we just want to make sure people understand the difference between those two. So let's continue on rest of the...
Especially in older people, they all complain. And somebody will say that somebody else, the older people need less sleep.
Yeah.
That's what we think. Actually, they function better when they have a good sleep. So, even older people, they may have problem with the sleep, but if they sleep well, they will function better in the long run. So, it is recommended for everybody.
Yeah.
As you already talk about that, they call REM sleep and non-REM sleep. And we have seen this, when people sleep, all of a sudden their eyes start to move. That is their REM sleep. And then they go to deeper phases of sleep, almost like a paralyzed. And they're very difficult to wake up. That is a non-REM REM sleep. That is the time actually our body tries to repair itself.
Yeah.
And if you wake them up in the middle of that non-REM sleep, they wake up very confused. And so it is important that we have several cycles of REM and non-REM sleep, at least 3 or 4 times, and just to make sure that we had a good night's sleep. And that's the time, as you say, it helps with the immune system. They get less infection if you sleep well.
Yeah.
And at that time, your body temperature drops, your metabolism slows down, and this is the time the body tries to repair itself through the whole day's work. So it is very important that we good night's sleep that sometimes we don't get.
That's true. And so for audience also want to highlight there are changes in the body happening with age, and so we have to realize those are normal changes. So some of changes with female will happen, they will wake up more because those are affected by some of the hormones, and especially estrogen. So if their estrogen is wearing off, then they will wake up more. Second is there's a difference between men and women, how they sleep, how they age. So men tend to lose their stage 3, which is non-REM sleep as we age. So very few men will have a stage 3 when they are older than 50s. On the other hand, women don't lose much. They actually keep their stage 3 or deep sleep, but the problem is they wake up a lot. So at the end, in the morning, if you ask same person, men and women, how did you sleep last night? Now men won't wake up and they don't go in deep sleep. They say, oh, we feel good. But on the other hand, if you ask female, they will wake up maybe 4 times and they'll say, I had horrible sleep, although they did go in deep sleep. So just remember, those are some of biological changes happening. Need for sleep does go down with age a little bit, but still pay attention to that you have to get adequate sleep no matter what age you have, because your memory, your emotion, both emotional and physical well-being depends on how well you sleep. So in immunity and immune system, those are very, very important. Like Dr. Jamil said, especially viral infections. A lot of people can catch flu actually if they sleep less than 4 hours or 4. So those are very important consideration. Please pay attention to those. So let's talk a little bit more on those.
If you go to the older people, they have a less REM sleep.
Yeah.
And that's the time we dream.
Yeah.
So if you ask older people, they'll say that they don't dream as much as used to. So that's how we know that they're not getting enough good sleep.
Yeah.
And there's one of the complaints, how come I don't dream? But, well, you need some time to dream, that you don't get it when you're not having enough sleep. What to do? And there's, I rather tell them not to take any medication if they don't have to.
Yeah.
Because, taking a shower before you go to bed, 90 minutes before, or don't watch television, and just to make your mind hyper. Those are the basic things that you can do, or don't read any books that are going to make you agitated or think too much about it. So those are simple things that we can do, or cool down slowly, and don't pick a fight. And the thing you can do is they call cognitive behavioral treatment.
Yeah.
And it is a psychological way to tell you that, when to go to sleep, when to go to bed, when to get up, and all those things, the structure that we need for a good sleep, they will do. They will actually help a lot.
Yeah.
They say that they are probably as good as taking a medication.
Yeah,
But
that's
good.
true.
And it is, sometimes we always want to take an easy way out and take a pill.
Yeah, so that's so true. The medications are never answers. So CBT, which is cognitive behavior therapy, is where we actually enforce sleep hygiene, which is going to bed and doing things in bed which we are supposed to do. Don't watch TV. I never understood why they have 10 or 11 o'clock news, because that sometimes can raise your adrenaline level. Maybe you should watch news earlier. And I don't think anything will change if when you go to bed. So don't watch late unless you really need to commute early morning. Just check the weather. Other thing is, I would don't have computer, no Facebook, no laptop there, and also remember things we do in bed, your brain remembers. So every sleepless night you didn't have in bed, it will remember it. So don't do those failures in bedroom, which means if you can't go to sleep, just move out of the bedroom or couch or somewhere else and just do that if you can fall asleep for 1 hour or so. So that is very important. Brain remembers every bad night you had in that room. So environment is very important. Second is get up on time, keep your rhythm always. Do not let it go wild. So once you do that, then it's very hard to reorient. Brain works like a clock. Clock moves forward. Backward is very hard, which means if I tell somebody to fall asleep 2 hours earlier, they can. But if I tell them to be awake all night or sleep by 2 hours late, they can. So imagine that the brain works like a clock, so then it's very easy to understand. Everybody drifts, their brain drifts by 15-20 minutes every day. It's our responsibility to keep it checked every day. It has to be synchronized every day. Your body rhythms, they are running on a clock, but you have to keep it synchronized. You cannot let it wild. Okay, so make sure this is the important part of CBT. I just want to make sure people pay attention.
If I may add to that a little bit, you said the most of the things more important, and you cannot force to sleep.
Yeah, you cannot.
If you go to bed and you cannot sleep, get up.
Yeah.
Go to other place, living room, sit down and read.
Yeah.
And when you come back to sleep, you'll be able to sleep.
Yeah.
It is almost like program your mind. The bed is something where you sleep.
Yeah.
So mind will remember that.
Yeah.
And then also, you don't drink caffeine or alcohol. Mm-hmm. You make sure that you turn off your cell phone completely. Don't put it in a bedside.
Yeah.
So that if you wake up in the middle of the night, you go up and check your telephone. That is gonna break your sleep.
Yeah.
Because the light from that, it will dampen your melatonin that you have in your brain.
Yeah.
So that how it is gonna slow down your sleep. You'll have a harder time to go to bed, sleep again. And then if you do an exercise, not before the sleep, like a 5 hour before sleep for 20 minutes, that is enough to help you to sleep. Mm-hmm. And sleeping during the daytime is a no-no.
Yeah.
Because it's going to make you sleep less at night when you need this.
Yes.
So those are the CBT thing that you do. Mm-hmm. And how about when nothing works? And CBT is cheap. Mm-hmm. You can do it yourself, and it's free. Mm-hmm. Going to a psychiatrist and psychologist is going to cost you money, and most of the time, insurance is not going to pay you. Mm-hmm. The 4 medication that been approved for sleep, and we use a lot of things over the counter, those are not approved. Mm-hmm. One is benzodiazepine, which is, it works, but it is habit forming, and it is better that we don't use that. Mm-hmm. There's some non-benzo medication like Ambien, sonata, which helps you to fall back to sleep and stay in sleep for enough time. Those have side effect. Sleepwalking is one of them, and they go up and eat, and they don't even know, and they can actually get out of the house.
Yeah, that's true.
And then there is the melatonin that we have. We can stimulate that. The name of the medicine is called Rosaram, and that also works because it increases your melatonin in your head. One psychiatric medication is called doxepin. That is approved. And it can be used, but side effect is also not good because of it causes dizziness, it can dryness of the mouth, it can problem with the urination retention, and also if you have a glaucoma, probably should not be using it. And in older people, glaucoma is not uncommon. And there another medicine is called Belsombra, and that works, but it can cause vivid dream. So some people don't like it either. So options are very limited that you can do. So we do a lot of other psychiatric medication for sleep, which is not approved but works partially. But I cannot name them because it's not approved.
So we'll just label it unapproved medication. Those are trazodone, Elavil, Neurontin. Those are, if people have used it, please do not use Benadryl. I'm telling again, it's over-the-counter Tylenol PM. Do not use NyQuil to sleep. Do not use alcohol to sleep. Worst thing anybody can do is drink alcohol and go to bed. So it changes the architecture of sleep and to your big disadvantage. So one of the important thing is in REM sleep is where actually most problem will happen to the body, because the body is literally awake. A lot of hormones are secreted, adrenaline and so forth. It races the heart, and people unfortunately die when there is a transition between REM and non-REM. Happens about 2 o'clock. So those are very important consideration which people don't realize that. So my wrap up will be, make sure pay attention to medications you're using. So any final thoughts on this?
Well, when we sleep, our brain doesn't sleep. It is very active. You're dreaming, you're trying to repair things, you're setting your memories in the right place. So it is important that we sleep. If somebody has trouble falling asleep, there is 2 medication you can take for those people who have chronic issues. One is Ambien, and there's a Remeron. It can do that, and also Trazolam. That's also does it, but you don't want to use that. And if you have you fall asleep, you can go to bed and sleep. Then you wake up, can't sleep anymore. For those people, Ambien is a good choice. Doxepin is a good choice. Medications have to be considered when you think that it's possible there is some issue with depression. Then you treat the depression and your sleeping will get better. And as you told many times before, Benadryl is not a good choice.
No, Benadryl is not a good choice.
Not only causes blurring of vision, it can make a glaucoma worse, urinary problem. And so those medicine probably needs to be avoided. But good thing to have a good habit of like a CBD, which is going to bed on time. Don't drink coffee or caffeine or alcohol before that. Setting a good time. And if you are not sleepy, don't stick in the bed. Get up and come back when you feel sleepy. And you have to wake up on time. You cannot change your waking time every day and expect that your sleep will be better next day.
And we use a term which is called social jet lagging, where people go to West Coast on weekend, which means they are up all night or late night parties, and they want Monday perfect. It's not going to happen. Sorry, but you cannot let your clock go wild on weekend. So don't do social jet lagging. It is very, very important. Understand limitations of brain. It will not change by 2-3 hours over 2 days. It's not going to happen. So be realistic and on those. So keep your rhythm. It has to remember there's a clock in the brain as well as clock in every cell, and it's regulated. There is a rhythm to it. If we distort that rhythm, don't expect this will improve overnight. It's not going to happen. So those are very important concepts to bear in mind. Anything else before we?
Another thing that we try to don't sleep for a few days, then try to sleep a longer time.
Yeah.
They call it sleep stacking, and it's not a practical thing to do. It's not a good thing to do because you never catch up the lost sleep.
Yeah. Okay. Okay. Well, thank you, and it was pleasure. Give us feedback, Twitter, email, and so forth. Good night. Thank you.